Hi, I'm Dr. Joel Cherdack. One of the most common questions we get from patients seeking stem cell therapy is, can stem cell therapy repair bone-on-bone arthritis? So the short answer to that question is yes, but first let me explain what bone-on-bone arthritis really is. So bone-on-bone arthritis is something that is a X-ray finding. So when you look at an X-ray and you see that there's very little joint space, a lot of times that's termed, quote, bone-on-bone arthritis. But in reality, the bones aren't growing together. As long as there's some movement in the joint, that means that there's cartilage that we can regrow to restore function to the joint. So when you're looking at an X-ray, some patients may have very little joint space, some deformity of the joint, and it looks like the bones are touching each other, yet the patient has very little symptoms and is able to function almost completely well. In other cases, you may see less degenerative arthritis, but the patient can barely walk or barely move whatever joint it is that's termed bone-on-bone arthritis. What we do is using stem cell therapy along with exosomes and platelet-rich plasma, we can restore the joint. Now, we're not trying to restore the joint to be a perfect joint. All we're trying to do is increase function and decrease pain to the point where a patient's comfortable and able to function close to normally or fully normally and is no longer a surgical candidate. So stem cell therapy along with growth factors will not only regrow cartilage in the joint, but it will also improve and repair the joint capsule itself, so what we call synovial tissue. It will also repair any ligaments, tendons, or muscles surrounding the joint, and it will also decrease the inflammation in the bone and the cartilage that's causing the joint to degenerate over time in the first place. So in some cases, we're able to get 90 to 100% improvement with patients that have been told they have, quote, bone-on-bone arthritis. And in other cases, if the degeneration is severe and the patient is perhaps overweight or perhaps older or perhaps not in the greatest health, sometimes we get somewhere in the range of 50 to 60% improvement. Now, both of those outcomes are meaningful in that they can help a patient be no longer a candidate for surgery and help restore function and decrease pain so that they can live a more functional life and be in better comfort and not be somebody who's going down the path of having to have a joint replacement. And the other thing that's really great about stem cell therapy compared to surgery is that the stem cell procedures can be repeated. So unlike surgery, we can do another stem cell procedure if the bone-on-bone degenerative arthritis starts to bother a patient and pain increases and function decreases. So if you've been told that you have bone-on-bone arthritis and you're looking for an alternative to surgery, please click on the link to our clinic on the bottom of the description of this video, which will take you to our homepage where you can fill out a free patient consultation request form, and our patient coordinator will reach out to you and answer any questions you have.